The journey of the youngest face transplant recipient in the United States is a story of resilience, hope, and groundbreaking medical advancements. This incredible tale has captured the hearts and minds of people worldwide as it highlights the triumph of human spirit and the marvels of modern science. National Geographic has documented this compelling narrative, shedding light on the life-changing procedure and its profound impact on both the recipient and the medical community. The story begins with a young individual whose life was irrevocably altered by a tragic accident. At just 18 years old, they suffered severe facial trauma that left them disfigured and struggling with both physical and emotional challenges. The accident not only changed their appearance, but also affected their ability to speak, eat, and express themselves. For someone so young, the journey ahead seemed insurmountable. Enter the field of face transplantation, a medical frontier that has only recently become a viable option for those with severe facial injuries. This procedure, which involves replacing a damaged face with that of a donor, is one of the most complex and intricate surgeries performed today. It requires a team of specialists, including surgeons, anesthesiologists, psychologists, and rehabilitation experts, working in harmony to achieve a successful outcome. In this particular case, the patient was identified as a candidate for face transplantation after undergoing extensive evaluations. These assessments ensured that they were physically and mentally prepared for the procedure, which would demand immense strength and resilience. The process also involved matching the patient with a donor, a step that requires a combination of medical precision and sensitivity to ethical considerations. The surgery itself was a monumental undertaking. Over the course of nearly 31 hours, a team of highly skilled surgeons meticulously replaced the patient's damaged facial tissues, including skin, muscles, nerves, and blood vessels, with those of a donor. This intricate procedure required advanced surgical techniques, such as microvascular anastomosis, to connect tiny blood vessels and ensure proper blood flow to the transplanted tissues. The success of the surgery depended on the team's expertise and the patient's body accepting the new face without rejection. The aftermath of the surgery marked the beginning of a new chapter for the young recipient. The immediate post-operative period was critical, as the medical team monitored the patient closely for signs of infection or rejection. Additionally, the patient embarked on a rigorous rehabilitation program to regain functionality and adapt to their new appearance. Physical therapy helped them relearn basic actions like chewing and speaking, while psychological support addressed the emotional challenges of adjusting to their transformed identity. One of the most remarkable aspects of this story is the resilience displayed by the recipient. Despite the immense physical and emotional hurdles, they demonstrated extraordinary determination and courage. Their journey inspired not only their medical team, but also countless others who followed their story. By sharing their experiences, the young recipient became a beacon of hope for individuals facing similar challenges, proving that life can be rebuilt even after the most devastating setbacks. The impact of this groundbreaking face transplant extends beyond the personal transformation of the recipient. It represents a significant milestone in the field of reconstructive surgery, paving the way for future advancements and improved outcomes for patients. The procedure also underscores the importance of organ and tissue donation, highlighting how one act of generosity can profoundly change another person's life. National Geographic's coverage of this story provides a window into the science and humanity behind face transplantation. Through stunning visuals, in-depth interviews, and expert analysis, the documentary captures the complexity of the procedure and the profound emotional journey of the recipient. It serves as a testament to the power of storytelling in raising awareness and fostering empathy for those who undergo life-altering medical interventions. Beyond the technical achievements, this story raises important ethical and philosophical questions about identity, self-perception, and the role of medical science in reshaping lives. What does it mean to wear someone else's face? How does this impact one's sense of self? These questions invite deeper reflection on the intersection of medicine, ethics, and humanity. The young recipient's journey is also a tribute to the donor and their family, whose selfless decision made the transplant possible. Their generosity and compassion provided the gift of a second chance, allowing the recipient to rebuild their life and reclaim a sense of normalcy. This act of kindness highlights the profound intercon